Years ago, a family brought a 25-year-old farmer into the emergency room with a gunshot hole over his heart and with no pulse or breathing for more than 10 minutes. It was a self-inflicted wound, and this young farmer would farm no more. The family was beside themselves with loud and sorrowful wailing that wrenched my soul. They told me that the impending harvest looked poor, the loan was coming due, and he had been isolating himself, drinking more and getting angry at every little thing. They had no clue he was at risk of suicide. Sure, he was a little down, but not this. He picked a permanent answer to a temporary problem. Significant thoughts of suicide occur in 1 of 4 women and 1 of 8 men. Although there are more attempts by women, more deaths occur by men. In 2017, there were 1.4 million attempts and 47,000 deaths due to suicide. And despite these high numbers, the money invested in depression and suicide research is sadly way low. Risk factors for suicide include family history or prior experience of depression or manic depression, a history of being abused or being an abuser, excessive use of alcohol, sleeping pills, or substance dependence, a recent emotional loss, or a significant medical illness. Also, there is higher risk during local epidemics of suicide in youth, especially on reservations. Sometimes depression and suicide have no reason whatsoever. How can any of us help ourselves or a person at risk? First, remember, it never hurts to ask, have you been thinking about suicide? Those words will not bring it on, but could encourage the person to find someone to give life-saving assistance. If you sense there is an emotional downward change happening, encourage that person to get help. If a depression is milder and not at the suicide level, non-medicinal therapy can give relief. Examples abound, such as a daily 30-minute walk, regular interaction with friends and family, and the regular opening of one's heart to spiritual connectedness. If more help is needed, talk with your physician or care provider and consider medicines that effectively work for depression. Although 2/3 of people with depression do not seek or receive help, when the 1/3 who do get help are treated, 4 out of 5 of those folks are better in a month. Get help if needed. Finally, if you are in the crisis, call the Suicide Prevention Lifeline at 1-800-273-TALK or 8255, which is available 24/7. Please don't choose a permanent answer to a temporary problem.